Assalamualaikum. My name is Rafizi Ramli. My part is problem identification. So at first, our group not really want to proceed in this problem, but it seems this problem may give a big impact. So let's straight to our main point. Our group has choose problem about image produced from the scanning device, not considered as a golden artifact or quality artifact. In the simple terms, the image does not reach the diagnostic value because by the many reasons, such as image probably had unwanted artifact, maybe came from the component itself, or any other lead or malfunction component. So for the more explanation, let's take another slide. So we start with interview process. We proceed the interview by two software or app. First, we are using WhatsApp app, and for the second time, we are using WebEx. We decide to interview person named A. They are working with Hospital US in Kelantan under the radiology department. There are so many information we get from the person A. If you guys wanted to know what we are talking and discuss about person A, this slide contain all the information about it.
For the problem analysis, here I have stated 4 problems, which the first one is the distance between the source, object and detector. Usually we know that this distance is being fixed because we want to control the radiation exposure toward the patient, but sometimes this distance will minimize the resolution quality image because we know that high radiation dose will produce high image quality, but still we cannot increase the radiation dose because we want to avoid overexposure radiation towards the patient because it will affect the patient's tissues and cells development. For the second one is high noise produced. Usually in CT scan, multiple detectors will be used to take X-ray image from a different angles around the body. Each detector will only record a particular part of an image, and at the end of this process, all of this image will be combined to produce one complete image. While this can produce a very high quality image, they also tend to produce an image with more noise, which will blurring the image quality. This is because more detector use will produce high noise. For the third one is X-ray tube failure. We all know that basically CT scan use an X-ray radiation as a medium of exposure. So when an X-ray tube is fails or malfunctioning, it can result in poor image quality or an inability to produce an image. This usually occurs when there are issues in the vacuum seal within the tube or damage the tube by itself. Other factors that may cause these things is because of the aging of the machine or wear and tear and improper maintenance by the engineers. For the last one is cloudy sensors and filter. Ambient temperature and humidity can affect the performance of our machine. This is especially important to the humid environment where water vapor can condense on the sensor and the lenses of the machines. So to avoid these things to happen, we need to make sure that the machine is placed in the room with the temperature of 22 degrees Celsius, and also we need to maintain the temperature because if the temperature drop or increase, there will be a water vapor that condense at the lens of the machine. Instead of just water vapor condense, the lens also can blurring because of the dust particle that attach to it. So to make sure these things not happening, we need to always wipe the sensors and check it every time you want to use the machine before we use the machine.
Next, we will talk about the impact on the patient. First, it will affect the clinical decision making. This will impact the treatment decision as the image produced is not clear. Without a clear image, it might be challenging for the doctors to identify certain condition or accurately assess the severity of an issue, potentially leading to the delay or incorrect treatment. Secondly, it will impact the diagnosis accuracy. This will affect if the image is not clear and the professional might make a wrong decision. For example, there was a case reported concern about this radiology reported of a CT scan to investigate a liver mass. The radiologists who reported the scan conclude that the mass was benign, non-cancerous. As recommended, a follow-up scan in 12 months' time. However, the follow-up scan showed cancer which has spread to other part of the man's body. Next, it will lead to the misdiagnosis. It has a high risk of misdiagnosis as the fine details are crucial in identifying certain type of pathology. Lastly, it will affect the patient uncertainty and anxiety. Patient may become more worried if the image result is not clear enough to interpret. Also, the patient might not receive a definitive diagnosis or treatment plan promptly. This certainly can lead to prolonged worry about their health condition, not knowing the exact nature or severity of the issue. Moreover, when they need additional tests or scan to clarify the situation, it can also cause stress and anxiety. As patients often desire quick answer and assurance regarding their health.
Assalamu alaikum, I am Amar Khalid and I will talk about the challenges and limitations related to our problem. Several challenges and limitations are associated with optimizing the balance between image resolution and radiation exposure in biomedical imaging modalities. Some of these challenges include 1. Radiation exposure concerns. High levels of radiation exposure can pose health risk to patients, including an increased risk of cancer. Minimizing radiation dose without compromising image quality is a complex task, and achieving the right balance is challenging. Number 2. Technological and engineering challenges. Implementing new technology that can reduce radiation exposure may involve significant cost, and the healthcare industry may face challenges in adopting these advances on a widespread basis. Number 3. Image quality and diagnostic accuracy. Balancing the reduction of radiation dose with maintaining sufficient image quality and resolution is a significant challenge. Lowering the dose may result in noisy or less detailed image. And for more challenges, we have number 4. Diagnostic accuracy versus radiation dose. Lowering radiation dose may compromise the diagnostic accuracy of the image, making it difficult to detect certain conditions or abnormalities. Number 5. Integration with clinical workflow. Integrating new imaging protocols into existing clinical workflow and practices can be challenging. Changes should be seamless and not disturb the efficiency of healthcare delivery. Last one, number 6. Clinical acceptance and guidance. The adoption of new imaging protocols and technologies faces challenges related to acceptance by the medical community and adherence to established clinical guidelines. Addressing these challenges requires a multidisciplinary approach involving collaboration between medical professionals, engineers, physicists, and regulatory bodies. Ongoing research and technological advancements aim to overcome these limitations and enhance the safety and effectiveness of biomedical imaging procedures.
Higher radiation doses generally lead to better image quality and increased visibility of anatomical details, but too much radiation may give bad effects to the patient. To prevent this, more friendly approach has been suggested. Field of view (FOV) is a crucial factor that directly affects the quantity of information acquired in picture when it comes to imaging instruments, such as cameras or medical imaging instrument. By that, we suggested that the FOV of the imaging machine to be reduced as it will result in increased pixel density and potentially allow the imaging system to capture more fine details and subtle variation within the image object. When reducing the FOV, the extra focus size will be decreased as well, along with the voxel size. As you can see here, when the pixel size is 0.2 millimeter, the spatial resolution of the image becomes better. As for machine like X-ray, we can change the magnification in the image intensifier. The image intensifier is made up of a sizable tapered, cylindrical tube with multiple internal features that transform the input X-ray distribution into a corresponding brilliant light image. To achieve smaller pixel, the focal point must be distant from the input phosphor to achieve a small magnification factor and achieve smaller FOV.
Next, we're going to talk about the advantages and disadvantages of reducing the field of view (FOV). So, for the advantages, by reducing the FOV, we can effectively increase the magnification of the image. So, this can be advantageous when you need to really focus on specific details or object within scene, such as during the target identification. Next, we can enhance the target resolution. A smaller FOV allows for better resolution on specific target, uh, then making it easier to perceive small details. So this is particularly beneficial in for our healthcare professionals to distinguish between the structures and the tissues. Last advantages is improving the image quality. So concentrated available light over smaller area can enhance overall image quality by reducing the spread of light. So then it will result a brighter and clearer image within the narrow FOV. Then for the disadvantages of reducing FOV, uh, it will limit the overall awareness of the operator, which is a narrow FOV may cause user to miss important peripheral information, reducing the situational awareness. Next, the difficulty in tracking moving targets. So a smaller FOV can make it challenging to track fast-moving target as the restricted field require constant adjustment to keep the target within the view. So this limitation is especially critical in dynamic environment. So last, disadvantages of reducing FOV is cost consuming or high cost. So image intensifier with adjustable FOV capabilities always come with higher costing. So the technology and mechanism required to achieve variable FOV add complexity and expense to the device.
So, as a conclusion, this problem will lead into many consequences, but we as an engineer will try our best to overcome and also troubleshoot every problem that being faced by the radiographer. For the current time being, the radiographer should satisfied with the current image quality if there is no technical issues or problem at the scanner machine, because we as engineer also need to make some research in order to increase the image quality, as we also need to consider the patient safety towards the radiation exposure.